With a relentless focus on excellence in healthcare, Pullman Regional Hospital presents the Health Podcast.
This is the Health Podcast, the show by Pullman Regional Hospital. I'm Evo Terra. I'll never forget the time I learned why we call a bump on the head a goose egg. My son taught me that lesson years ago when, during a competitive game of hide and seek, he ran headlong into the door jamb, of course, leading with his head. The resulting, goose egg had this newly minted young father desperate for medical attention. Now, in that situation, should I have taken him to the emergency room, or would an urgent care facility suffice? Today, I'll talk with Dr. Ben Rhodes, an emergency medicine physician at Pullman Regional Hospital, so we can find out together. Dr. Rhodes, what types of illnesses should be treated at urgent care versus the emergency room? And why is that?
So, for the emergency room, we typically think of things like life, limb, or eyesight. For urgent care, I typically think of things that could wait a couple days to get seen, or something maybe that's not limb or life-threatening. So if you cut yourself when you were doing dishes or cutting up a vegetable, you could probably get seen at the urgent care. But if you have a bone sticking out of your leg, you should probably go to the ER.
That seems a pretty obvious way that many of us could get that right. Why do you think so many of us get it wrong?
I don't think necessarily everyone gets it wrong. I just think sometimes it depends on the time of day people are seeking care. You know, if you cut yourself at 2 a.m., the urgent care, unfortunately, is not open, so people often will go to the emergency department. Or sometimes they just don't know how bad their condition is. They may be worried about something that they may not actually have, but they want to get evaluated, and I think that's appropriate because we can also provide some reassurance to people that they don't have something big, bad, or scary, but we want to get them seen and we want to help them out.
That makes a lot of sense for injuries. I wonder more about what I would classify as a layperson as a disease. Are there certain signs and symptoms we should be looking for that clearly say that's emergency room, even though it's not a life, limb, or eyesight?
So things like chest pain, a head injury, severe abdominal pain, passing out, shortness of breath, bleeding that doesn't stop after 10 minutes, seizures, obvious broken bones, major burns. These are all things that probably should be seen in an emergency department, whereas things like a ankle sprain, ear pain, a mild cough, nausea, vomiting, those may be things that can be seen in urgent care.
For people out there who are wondering about beyond signs and symptoms, we also worry a little bit about cost. So can you talk about the differences in the cost between going to an urgent care and an emergency room?
So the cost of an emergency room is higher than an urgent care. The big thing that differentiates that cost is the staff available. So in an urgent care, we often have a mid-level provider and maybe a tech available to help you. But in the ER, we have a full-fledged staff. So if someone comes in a cardiac arrest or having a heart attack, we can have 4 or 5 people that can attend to them and give them care that will help save their life. So when you come to the ER for a routine care, having that staff available costs more. Even though we may not be treating you for a significant injury, it's going to cost more because we have to have that staff available for those that do.
Right. And I think it might be partly that knowing that this staff is there, knowing that you are typically attached to a hospital, you might think you're going to get the best possible care there. However, as you mentioned, while that may be true, there's a cost penalty to that. And there's also, I would imagine, doctor, the factor of possibly not letting someone else get the care that they do need in an emergency situation, not just your urgent situation.
Yes, if non-emergent patients, they can increase wait times in an emergency department, but we have a system called triage that helps us to see the patients that need to be seen emergently, get them back faster so that we can prioritize their care over others that may have simpler conditions.
You mentioned wait times a moment ago. I know that, and I say no, I as I understand it, as I think about it, I think emergency rooms, I might take a very long time to get seen, where an urgent care might be quicker. Can you talk to some information around wait times?
So here in Pullman, That's really not the case. Our average ER wait time to see the doctor in Pullman is 6 minutes, but we're a small town with a community of 30,000 individuals, so we really don't have a problem with wait times, either for ER visits or for urgent care. In bigger centers or bigger cities, they can sometimes have hours to wait, but here in Pullman, for the ER anyway, it's a 6-minute wait time to see a provider. So,
should I worry too much about the differences in care provided? You mentioned how each are staffed, but if that's my deciding factor, should it be?
Sometimes people want to see a doctor. They don't want to see a physician assistant or a mid-level provider, and a lot of times that's how urgent cares are staffed. There's a experience difference when you're seeing a doctor versus a mid-level provider, just a increased time in training. Mid-level providers don't do a residency, whereas a doctor spends 3 years or 4 years or even 5 years doing a residency before they're out practicing on their own. So that experience sometimes want that opinion coming from a more of an expert.
That's Dr. Ben Rhodes, an emergency medicine physician at Pullman Regional Hospital. Thank you for listening to this episode of The Health Podcast, the show by Pullman Regional Hospital. I am Evo Terra. If you found this episode helpful, please share it on your social channels. And be sure to check the entire library of past episodes. You can learn more at pullmanregional.org.